Hey, welcome back to Regenerative Performance. So today I want to talk about this hip complex that is a frequent problem with athletes. Now, when we think of the hip complex, we have, our TFL, our quads, our Psoas, which we're going to talk about because a lot of people don't even know about that. But it tends to get tight because we're sitting a lot, as students, working a desk job, whatever it is that you do, right? Sitting takes that psoas into that shortened position and it attaches onto the lumbar vertebra on your spine, goes down to the femur. So by compressing that all day long, the body gets used to that. You go to stand up and your back hurts. It's because that psoas is yanking down on those vertebrae, causing you that pain. A lot of athletes too might have this hip complex where they've got pain in the anterior hip as they come through in full extension, or even they've got that lower back pain because as they come through into this extension position, if they're missing that range of motion through that hip, they're going to compensate, and that psoas is going to pull on that lower back and put you into this anterior tilt. That's just not fun. So today we're going to address that psoas and then also just a general hip opener. So first we're going to find the psoas. So that psoas is about 1 inch over from that belly button, and it runs down to the top of the iliac crest there, that hip. So we're going to come on the ground here. You're going to take your ball and you're going to place it right beside that belly button, and you're just going to put some weight into it. Now, it's important to not put so much weight into this, or if you're super tender, you want to use a tennis ball or something a little softer. But you don't want to put so much pressure into it that you can't breathe, because then you're not able to get that muscle to relax. And that's super important for that mind-muscle connection of, tricking the brain into relaxing this muscle. So you're going to find those spots that are gnarly and just kind of don't feel great. And you're just going to want to do a couple breaths into that and just try and relax. So spend about 2 minutes on each side, kind of coming down from that belly button all the way down to that hip. And then on the other side. And then once you're done with that, and make sure you do that one first before this hip opener. So once you've done that, you're going to grab a mat, and you're going to come up into the wall. Get your knee into the wall crease. And if you can't get all the way back there, it's okay to start out here. But if you can, get that all the way back. And this is the first position you're going to hang out in. So if you're okay here and you're like, you know what, Drew, I don't really feel a stretch, then we're going to step it up a bit. But first is this position. It's important to not let that hip kind of hike up, because we're trying to get that extension through this anterior hip. So if you're in this position and you're stretching, you're not really stretching unless you squeeze that butt and get down into that extension position. So this is your first position. And if this is enough for you, hang out here for 2 minutes and then switch over to the other side. Now if this isn't that much of a stretch, then what you can do is you're going to bring that other foot up and around. Now it's important when you do that, again, not to sit those hips up high again and lose that extension. So you're going to be down here, okay? Your chest is not going to be extended upwards. You're going to be here, you're going to squeeze that butt, and you're going to feel that stretch all the way through the hip, that anterior quad, and then even down towards the knee. So from here, you're going to hang out for 2 minutes if this is enough for you, right? I don't want you coming up here and you can't breathe, because then again, you're not getting that release through the muscle. So from here, if you can, you're going to squeeze that butt and you're going to come up and you're going to keep that chest and lumbar vertebra, that lower back, you're going to keep them in this good position, right? You're not going to open up, you're keeping down. And then from here, again, just that breathing and try and get through that 2 minutes, and then you're going to switch sides. So that's what I want you to do today. So spend 4 or 5 minutes per exercise, right? 2 minutes per side, 10 minutes today, and open up those hips. See you next time.